Anxiety is a complex emotional response that everyone experiences, but it can feel overwhelming, especially for children. It emerges as a feeling of fear or panic, often triggered by stressful situations, leading to a state of heightened alertness. For many children, mild worries are a natural part of their development, helping them recognize danger and keep safe. However, when anxiety begins to interfere with daily activities, it becomes crucial to address it to ensure a child's healthy emotional growth. The root causes of anxiety can be multifaceted and difficult to identify. Stressful situations activate a defensive mechanism in the brain, which signals the body to prepare for a threat. This response can manifest as increased heart rate or a strong urge to flee. These instinctual reactions are meant to protect us but can sometimes spiral out of control, especially in children who may struggle to understand and manage their feelings. Early intervention is essential to teach children how to navigate their anxieties, allowing them to differentiate between real threats and perceived fears. Children experience anxiety in various forms throughout their developmental stages. For instance, between the ages of 6 months to 3 years, separation anxiety is common. Young children may exhibit clinginess and distress when apart from their caregivers, which is a normal part of growing up and typically resolves by age 3. As they enter preschool, it's not unusual for fears about the dark, animals, or loud noises to surface. These age-specific fears generally diminish over time but must be monitored. If anxiety persists into school years, manifesting as reluctance to participate in new experiences like starting school or social gatherings, professional support may be necessary. Recognizing when anxiety becomes problematic is vital for parents. If a child's fears disrupt their ability to enjoy activities or significantly hinder daily life, seeking help from a mental health professional is essential. Only experts can provide a proper diagnosis and support strategies to help manage anxiety. Open lines of communication with your child are crucial in helping them express their feelings. Engaging children in discussions about their worries fosters a supportive environment where they feel understood and valued, leading to healthier emotional coping mechanisms. Anxiety is a common yet often overlooked issue in children, manifesting through a variety of signs and symptoms that can manifest over time. Parents may notice physical symptoms such as shortness of breath, headaches, or a feeling of faintness. For a child experiencing anxiety, a racing heart can surface unexpectedly, sometimes accompanied by spikes in blood pressure, leaving them feeling overwhelmed and uncertain. In addition to these physical manifestations, children may exhibit behaviors like fidgeting, trembling, or experiencing weakness in their legs. A nagging feeling of sickness could lead to cramps or diarrhea, resulting in frequent bathroom trips. Anxiety can disrupt a child's night, leading to trouble sleeping or a diminished appetite, while excessive sweating or a dry mouth might indicate rising anxiety levels. Recognizing these signs early is vital for providing support. Emotional and mental symptoms are just as telling. Struggling to focus or maintain concentration is common among anxious children who might feel panicky or constantly on edge. They may express feelings of being overwhelmed, plagued by a sense of dread in everyday situations. A heightened sense of fatigue and irritability may also signal anxiety, as the child navigates their internal emotional turmoil. Every child's experience with anxiety can vary greatly, making it crucial to understand that reactions may differ based on individual temperament and circumstances. It is completely natural for some children to feel more anxious than their peers, especially in response to similar situations. Anxious children often seek reassurance and comfort from their parents or caregivers, responding positively when they receive validation. These children may also be more subdued, quiet, or exceptionally eager to please, traits that can mask their anxiety, making it difficult for peers and adults alike to discern their emotional distress. Being attuned to potential signs of anxiety enables parents to take proactive measures. Regular communication with your child, letting them express their feelings, can lead to timely interventions. In fostering an environment rooted in understanding and comfort, caregivers can help children navigate their anxiety more effectively. Whether through therapy, talking, or supportive activities, early and consistent care can make a significant difference in a child's journey to coping and recovery. Be alert, be supportive, and ensure your child feels safe to express their feelings. Ways to help your child cope. If your child is feeling anxious, the first thing you can do is remind them is that the feeling will pass. This will help to soothe them and feel less anxious. There are things you can do to help them cope and be better prepared. Explore the feeling together. Ask your child to observe their feelings of anxiety and tell you what is happening when they feel anxious. How do they feel? How long does the feeling last? And what might be the reason for feeling anxious? The more they can understand the feeling and feel safe, the easier it can be to manage it. Shift the focus. Because they cannot control their feelings, anxious children often ask themselves questions they cannot answer, like, why is this happening? Or why me? Asking questions like, what would you like to have for dinner? Can help them feel empowered and to focus on the present, support healthy habits. Sleep and eating well can positively influence anxious feelings, as we often feel exhausted after feeling anxious for prolonged periods of time. Experts recommend 9 to 12 hours of sleep a night. For 6 to 12-year-olds, teens need 8 to 10 hours a night. To protect sleep time, limit screen time at night and avoid keeping digital devices in the bedroom. 4. Help them use their senses. Our senses are powerful tools to deal with feelings of panic, anxiety, and stress. Here's an easy way to encourage your child to use them. Ask your child to sit comfortably and slowly breathe in and out. Now ask them to name some non-distressing things. 4 things they can see, 3 things they can hear, 2 things they can smell, and 1 thing they can taste. Practice belly breathing. Often when we are anxious, our breathing becomes shallow, high in our chests, and we forget to breathe deeply into our abdomens. Abdominal breathing is very calming and helps us to draw oxygen deep into our lungs. Here's an easy 3-step process. Place your hand on your stomach. Take 5 deep breaths. Spend 5 seconds breathing in and 5 seconds breathing out. Breathing in through your nose and out through your mouth. Explain that when your child inhales, they are blowing up their tummy softly like a balloon. And when they exhale, the air is going slowly out of the balloon again. Every parent hopes to provide a nurturing environment for their child, but sometimes challenges arise that can affect their emotional well-being. Anxiety, though common, can seep into various aspects of a child's life, hindering enjoyment and growth. Recognizing when your child struggles with anxiety is the first step towards getting them the help they deserve. When anxiety becomes overwhelming or persistent, affecting your child's daily life, it may be time to seek professional assistance to ensure your child's mental health is prioritized. Consulting a healthcare provider is a crucial move. A knowledgeable professional can guide you through the process of getting a mental health assessment for your child. This assessment can pinpoint the specific nature of their anxiety and provide clarity on the best treatment options available. The support of trained mental health professionals is invaluable. They can utilize effective therapies to address anxiety symptoms and equip your child with coping strategies that enhance their resilience. Through counseling or talk therapy, your child can explore their feelings, gaining a better understanding of their emotions and learning to navigate life's challenges more effectively. As a parent, it is essential to remember that your child's anxiety is not a reflection of your parenting abilities. Children do not choose to feel anxious deliberately. Their feelings are often rooted in a myriad of unresolved issues or situations beyond their control. Validating their emotions and showing support can reduce the stigma often associated with mental health struggles. Your empathy assures them that it's okay to feel this way and that help is available. By fostering an open environment where feelings can be expressed, you encourage your child to communicate freely. Together, with patience and guidance, anxiety can be managed and ultimately overcome, paving the way for emotional health and well-being. Seeking help is a sign of strength, not just for your child, but also for you as a parent. Embracing the journey of seeking professional assistance can lead to significant improvements in mental health. Overcoming anxiety takes time, but with love, attention, and the right help, your child can thrive. Remember, you are not alone in this. Many families share similar experiences, and support networks are available to guide you. Empower yourself and your child today by taking that significant first step toward a healthier future. This is Sajjad Ahmad, a life coach, hypnosis trainer, and body language master trainer. Thank you for watching and listening.